Hey everyone, and welcome to this explainer. Today, we're diving into something that literally touches millions of lives across the globe, clinical depression. Now, there are just so many misconceptions floating around out there about what depression actually is. It's often written off as just a passing mood, but actually, scratch that, it's a very common, very serious, and importantly, highly treatable medical condition. So whether you're looking for answers for yourself, trying to figure out what a loved one is going through, or just wanting to get up to speed, you're in the right place. We're going to break down the science, the symptoms, and most importantly, how we get to recovery. Okay, let's dive into this with a really powerful quote from Dr. Craig Sachuk over at the Mayo Clinic. He hit the nail on the head when he said, "Depression isn't a weakness or a character flaw. People who experience depression can't just snap out of it." And man, that is so crucial to hear, because unfortunately, there is still this heavy stigma hanging over this condition. If you are experiencing depression, listen to me, it is not your fault. It's not about just being in a funk, and it definitely isn't a lack of willpower. Getting that straight is literally step one in understanding what this illness really is. To really shatter that stigma, just look at these numbers. Basically, 1 in 6 people will experience a major depressive episode at some point in their lives. To put that into perspective, we're talking about up to 16 million adults dealing with this every single year, just in the US alone. It crosses all lines, age, race, biological sex, income, you name it. So if you're dealing with this right now, I really want you to hear this. You are absolutely not alone. This illness is incredibly common. So here's our roadmap for today. First, we'll cover understanding clinical depression, then recognizing the symptoms, causes, and risk factors, getting a diagnosis, exploring treatment options, and finally, finding help and support. Let's jump right into part 1, understanding clinical depression, more than just the blues. Right off the bat, we need to draw a hard line between normal, temporary sadness, what we usually just call the blues, and an actual clinical mood disorder. According to diagnostic manuals like the DSM-5, major depressive disorder, or MDD, is a mood disorder causing a persistent feeling of sadness and a loss of interest. But here is the real kicker. It lasts most of the day, nearly every day, for at least 2 weeks. Look, it is totally normal to feel sad after a tough life event, like a breakup or losing a job. But clinical depression, it fundamentally rewires how you feel, think, and function for weeks or even months on end. It can completely upend your day-to-day life. Moving on to part 2, recognizing the symptoms, a wide-ranging impact. Now, what's really interesting about this slide is just how wide-ranging the impact actually is. Depression doesn't always look like crying or just feeling down. Sometimes it's a total lack of emotion, like you're just numb, or it can be this overwhelming, severe frustration. And what's truly wild is how it messes with your cognition, your literal ability to think clearly. We always hear about the emotional stuff, right? Constant emptiness, angry outbursts, which is super common in teens, by the way, or just completely losing interest in your favorite hobbies. But those cognitive symptoms are a massive roadblock. People describe this thick brain fog that makes it almost impossible to concentrate, make decisions, or even remember things. Your thoughts can just spiral into a negative loop, obsessing over past failures and creating this crushing weight of self-blame. And in severe cases, this can lead to frequent bouts of death. But, it doesn't just stay in your head, it physically drains your body too. Sleep goes completely out the window. You might be lying awake all night with insomnia, or you might end up sleeping way too much. And the fatigue? It's extreme. We're talking about a level of exhaustion where just getting dressed feels like running a marathon. You might also notice big shifts in your appetite, which leads to weight loss or weight gain. For some folks, even their speaking or body movements slow way down, and they might start getting these random physical issues, like unexplained back pain or headaches. So you can see how this creates a brutal cycle, right? The brain fog and self-doubt make you pull away from the world, and then the physical exhaustion makes trying to jump back in feel completely impossible. Part 3, causes and risk factors, a complex puzzle. So what actually causes all this? Well, it's super important to understand that there is no single on switch for depression. It's more like a giant puzzle made up of overlapping vulnerabilities. On the biological side of things, genetics are a big player. If you have blood relatives with depression, your risk goes up. We're also looking at literal physical changes in your brain chemistry, like a mix-up with neurotransmitters such as serotonin and dopamine, which basically manage your mood. Throw in hormonal shifts, maybe from pregnancy or a thyroid issue, and chronic illnesses like diabetes or heart disease, and it's a lot for the body to handle. Now compare that with the environmental side. Things like traumatic life events, chronic stress, financial struggles, or just not having a solid support system. It's really the collision of these internal biological gears with its external life triggers. Again, this just makes it so empathetically clear. Developing depression is a medical reality. It is not a personal failure. Let's move to part 4, getting a diagnosis, the crucial first step. Let's see how this builds. Once you recognize the symptoms, how do you actually confirm it's depression? Well, getting a formal diagnosis is brave, and it's absolutely necessary, especially to make sure nothing else is going on medically. Let's pull back the curtain and demystify what a doctor's visit actually looks like for us. There's no magical lab scam that just prints out that it's depression. Instead, it usually takes off with a critical interview, where your doctor will just chat with you about your mood, your thoughts, and how your daily life is going. Step 2 usually involves some validated questionnaires, stuff like the PHQ-9. You just fill these out so the doctor can gauge how severe the symptoms are. And then step 3 is huge, medical tests. They might run some blood work just to be absolutely sure your symptoms aren't actually coming from a sneaky thyroid issue or severe vitamin deficiency. All right, part 5, exploring treatment options, the road to recovery. And that brings us to a really hopeful place. If there's one NASA takeaway today, it's this: treatment works. Now, the World Health Organization notes that in high-income countries, only about a third of people with depression are currently getting mental health treatment. But we want to change that stat by showing you exactly what the options are. Here's a high-level look at the 3 main pillars of treatment: psychotherapy, medication, and lifestyle or alternative treatments. Now, full disclosure, there's no one-size-fits-all cure here. It's a highly individual thing, but most folks feel a whole lot better with a custom mix of these pillars totally tailored to their specific symptoms and their medical history. Let's zoom in on psychotherapy or talk therapy for a second. This isn't just about sitting on a couch and venting, it's about learning real, practical, active coping skills. Cognitive behavioral therapy, or CBT, is a real game changer here. It basically trains you to spot and break that destructive cycle of negative thoughts and self-doubt we talked about earlier. Then there's systemic therapy, which zooms out to focus on your relationships, helping you improve communication with your family or your coworkers. And behavioral activation? That's all about slowly, steadily getting you back into the hobbies and activities that actually boost your mood, which fights off that intense urge to just hide away. Then we have the second pillar, medication. Doctors will often prescribe antidepressants like SSRIs or SNRIs, and these essentially help rebalance those brain chemicals we touched on earlier. So the crucial point is this: patience is absolutely required. These meds do not work overnight. It often takes several weeks of taking them every single day before you start to really feel a noticeable shift. And you gotta keep taking them consistently, even after you start feeling better, to keep the depression from creeping back in. Your doctor will keep a close eye on you to manage any side effects and tweak the dosage if you need it. Finally, part 6, finding help and support. You are not alone. Seriously, if you take absolutely nothing else away from this explainer today, please let it be this. It's without a doubt the most important thing we'll talk about. If you or someone you love is in immediate danger, or if you're having thoughts of self-harm or suicide, there is immediate safe support available for you right this second. In the US, you can just dial or text 988 to reach the Suicide and Crisis Lifeline. There is a real person sitting there ready to help you 24/7. It is completely free, and it is 100% confidential. You do not have to carry the heavy weight of depression all by yourself. Well, we've covered a ton of ground today, right? From the brain fog and physical exhaustion of the symptoms, to unpacking the biological and environmental puzzle pieces, all the way to those highly effective pillars of therapy and medication. Remember, help is out there, and clinical depression is a highly treatable condition. So whether it means making a doctor's appointment, opening up to a trusted friend, or just dialing 988, what does it look like for you to take that very next step and reach out today? Thank you so much for joining me for this explainer, and please take care of yourselves.